Taoiseach, the parents of children with scoliosis and spina bifida waiting years for their operations would have been listening intently to your budget yesterday, listening in the hope that you might finally hear their calls for action, that you might finally deliver the investment and change that their children so desperately need so that they might get their surgeries to end their nightmare of being stuck on a waiting list or struck off one. Although your budget book has 168 pages, there is no mention of these children with scoliosis and spina bifida, nor one single line specifically outlining a solution. And despite the hype around your budget, children with scoliosis will continue to wait in pain, continue to deteriorate and continue to run out of time. Children like 13-year-old Dara Higgins from Galway. Dara was born with spina bifida. He has been waiting for surgery for 5 years. He's been lost in a system that has failed him. His condition is ever worsening. His spinal curve is now 120 degrees. His mother, Ciara, posted a video on social media last week telling Dara's story. Taoiseach, Dara's scoliosis is now crushing his lungs, his bowels, and his heart. And Ciara, his mother, tweeted, "My son never had heart issues until his scoliosis was left to crush his body." She's worried, she's terrified. Her big fear is that Dara becomes inoperable, just as other children have become inoperable as they waited and waited. His mother, Ciara, has been waiting for surgical intervention, a surgical plan, communication on her son's scoliosis treatment for far too long. He has been assessed for surgery in the United States, but there is still no clarity if Dara or when Dara will have the operation, whether it will go ahead. No clarity on travel plans, costs, length of stay. They've been given nothing in writing and they are now racked with uncertainty. There are concerns that Dara and other children with spinal curvatures and complex medical needs might be asked to travel, if they travel, in economy seats on flights. I don't know if you've seen Dara's video, Taoiseach. You have. So you couldn't possibly expect a young lad in that situation to be crammed into an economy seat for a transatlantic flight. Some of these children, like Dara, have to be repositioned so they don't get pressure sores that prevent them actually getting the surgery they need when they land in America. So this needs to be sorted out pronto. Last week, ahead of the budget, as members will know, parents of children with scoliosis and spina bifida came to a briefing in the Oireachtas AV room, and a 14-year-old boy, a wonderful young man called Tommy Long, addressed the meeting. During his time on the waiting list, this child has been through it all, Taoiseach. Here's what he had to say. Tommy said, "It's extremely disappointing to have seen no improvement for me or for the hundreds of other children with scoliosis over the last 10 years. Mahura an mushéid seo lani le scoliosis agus spina bifida ag olingt ag fonnacht abroad." So Taoiseach, here's my question for you. You made no mention of these children in your budget. Can I ask you, where is the funding to finally deliver on the promise that no child would wait, a promise made a long time ago and broken many, many times? Where's the money to make sure that Dara, in particular, gets to the United States, gets the treatment he needs, and indeed the funding and resources to look after all of the other children who are currently suffering in agony?
Taoiseach, please.
Well, thanks very much, Deputy, for raising this issue. And Ciaran Corley, it is a very important issue, and I'm pleased that we are raising it in this House, because I do think nobody in this House wants to see any child wait in pain. And any effort to suggest that you don't and I'm somehow or other satisfied that children are in pain is obviously not a fair portrayal of any public representative in this House. This isn't an issue that divides political opinion. And I can absolutely assure you, if you were in my role, you'd be doing what I'm doing too. You'd be meeting the clinical lead, you'd be meeting the head of the HSE, and you'd be working through the issues with them. And I'd invite you, actually, and I will arrange for you if you wish, to meet with the clinician in charge of this programme for scoliosis, because I'm very happy to address the issue on the floor of the House, Ceann Comhairle. What I often find it difficult to do on the floor of the House is discuss the individual clinical care plans of children. And were I to do that, I think you'd have difficulty with it, because there is a role for politicians, and obviously there's a role for clinicians. And I do think that's an important thing to say. But let me be really clear at the outset, and let's not be disingenuous, because you're at this Leader's Questions a hell of a lot longer than I am, Deputy, and you know from budgets that the HSE budget comes in a service plan, and you know that's where the detail is found in terms of the line-by-line item. And you can choose, if you wish, to use your time to suggest that government did not care about an issue, and that's fine, and maybe it's even your job, but it's not accurate. The HSE will now work through the level of funding that they've received from the government with the Minister for Health, and they will produce their detailed HSE service, and that's how it's worked every year. You've been in this House. It's how it works this year as well. So let me be very clear. The agreement that Minister Donoghue and Minister Donnelly received this year for health is very significant. It brings the total health budget to 25.6 billion. It means that health spending has now doubled over the last decade, and staffing will have increased by 30%. And what it also means is that there'll be real opportunity to make progress on all waiting lists, as we have been doing in recent years. It also means that there'll be further ability to invest more in paediatric spinal waiting lists as well. The Minister, and I fully support him on this, has said to families, he said to doctors, he said to the HSE, he said in this House, that any resources that are required by the dedicated spinal unit that he's established will be provided. And that has been the case up to now. So I've met with the Minister, I've met with the HSE CEO, I've met with the clinical lead of the dedicated spinal unit. This is now being led by a clinical lead, Mr. David Moore, and I've met with their teams. And I know that every single possible avenue and resource is being put to use. The Minister himself is now chairing a monthly meeting with the HSE and Children's Health Ireland on the waiting times, and he's ensuring that everything can be done. There's a paediatric spinal task force established with an independent senior council chair, Mark Connaughton, and we're committing significant additional investment to help tackle waiting lists and ease the burden. And this has resulted in a very significant increase in the number of paediatric spinal procedures carried out in 2022 and in 2023. And so far this year, over 300 spinal procedures have taken place, and that's important to acknowledge. For every child you name, and you're right to highlight them, absolutely right, there are children getting these operations and getting them at a scale and a pace that wasn't the case in years gone by. As you know, additional funding of a further 1.34 million was allocated when the new clinical lead requested it, and anything the new clinical lead requests will be provided for in the HSE's budget for the time ahead. You raise a very important specific issue, and I welcome you raising it, and I agree with you in relation to the difference between economy and business class and making sure that Dara or anybody travelling has that space to travel safely and appropriately. I agree with you on that. An arrangement with Morgan Stanley Children's Hospital in New York has been finalised. Consultants from New York have travelled to this country to see patients at a clinic in Dublin, and following a clinic held in Dublin with surgeons from Great Ormond Street Hospital in London, a group of patients have also been offered treatment abroad, and this is now in progress. An arrangement is also being finalised with Portland Hospital in the UK, and I'm assured that families will be fully supported in accessing these pathways if it is the right option for their children, and a support package will be put in place to support them in travelling, including flights, accommodation, transport, travel insurance for all those in the travelling party, and quite rightly a subsistence rate for expenses as well. And I'm assured that 2 of the flights for any family travelling will be business class, and I'm meeting scoliosis advocacy groups next week. I'm very happy and eager to discuss all these matters.
The clinicians give the clinical advice. I'm not asking you for clinical advice. Why would I? I'm suggesting nothing of the sort. And I would ask you kindly, when I raise the issue of a 13-year-old boy with a 120-degree curvature of his spine, who has waited 5 years for his surgery, that you do not insult him, don't mind me, or his mother, Ciara, with smart aleck, slick responses. This child has waited 5 years. This child is suffering. This child can be treated in the United States. Ciara, his mother, has told me, the clinicians have told her, 4 weeks halo treatment, which she can't access here, a further 4 weeks at least for the surgery, which will be complex, but they can do it. She needs clarity. She's been given the runaround by a bureaucracy that is in love with itself, by paper pushers and by layers and layers of unnecessary complexity, when the case is very simple. The child is 13. 13-year-old boys don't want to be mentioned on the floor of the Dáil. I know, I reared one myself. The last thing that he wants is his name mentioned here. And yet his mother is so desperate now, she felt moved to put up a video of him and to ask that this be raised directly with you. He can get the treatment he needs in the United States. She needs to know when they're travelling, they in the United States need confirmation that the resources are available and that the bill will be paid. And I am challenging you as Taoiseach, because if I were Taoiseach, I would sort that out. Sort that out today, Taoiseach, for that family.
Thank you. Taoiseach.
You'll understand, Ceann Comhairle, why I'm finding it hard to take a moralistic lecture on child protection from the Leader of the Opposition today of all days. Today of all days. You might come back to us on that. I can't ask you a question in this House, but there's a function available to you in this House and you should use it. And you should use it, because you should apply the same standards to yourself as you apply to everybody else. I'll answer the question. You try to do this thing, you stand up and you talk about slick and sound bites. You've obviously decided, I'm now living rent-free in your head. That's fine. The reality of the situation here is, Deputy McDonald, I'll work with this family. But I won't have you wrongly represent who I am or my values or the work that I do. I will work every day to help every child that needs access. And we delivered a budget yesterday that will make substantial progress. I've already outlined to you, I'll be meeting directly with the family advocacy groups next week, because I don't need you as an intermediary. I'll be meeting them directly. And I'll be working with them. And I'll be working with the Minister for Health. And I'll be working with the clinician who carries out these surgeries, who's now the clinical lead, to do the best thing possible. And we will put every support in place. And I assure you of that.
Thank you. Deputy Paediatric, please.